Good morning. Your student Professor Dr. Dolphy Gilpin, and I'm in part two of the focus on chlorine. And we have pulled out our card from our deck, and here we have chlorine 35, atomic mass 35.45, and atomic number of 17. And I hope I remember to show it to you on the periodic table. But let's continue. Some positive and negative effect of chlorine. So we say now that chlorine was first used to purify water in the United States in Jersey City, New Jersey in 1908. That's some little history. And you have chlorine and you have chloramine, right? They kill disease caused by Salmonella, Campylobacter, and Novovirus. Now, adding chlorine to water will also oxidize any iron that is in the water. So Fe would be oxidized, and also magnesium would be oxidized. And the chlorine remove odor and taste from the water. It also will destroy any hydrogen sulfide that is in the water. You know that offensive hydrogen sulfide gas. The hydrogen sulfide aqueous dissolving in water, the chlorine will also help to destroy the hydrogen sulfide in water. You know that the diseases caused by impure water include typhoid, fever, dysentery, cholera, and legionnaires, and chlorine helps to prevent all these diseases. Via chlorination and chloramination. So chlorination and chloramine and chloramine, well, my tongue is tied. Chloramination. All right. So drinking water with too much chlorine can cause nausea, vomiting, throat and stomach irritation, and vomiting. And may also contain chlorine smell, the smell of chlorine. Now the CDC, the Center of Disease Control here in United States, has recommended a safe chlorine level of about 4 milligrams per liter or 4 parts per million. That's the safe level that the CDC has recommended for chlorine. And what we have is a brighter E-light filter, which is certified to reduce chlorine levels to safe level of odor and taste. So the brighter filter is used to reduce chlorine level to safe levels of odor and taste. But the brighter filter is not certified to remove the chloramines. And as you know, if we have like chlorine in water, if we have to remove chlorine naturally from water in small scale operation, we could just allow it to stay in the air, and by it remaining in the air, in the atmosphere, it removed the chlorine. And also, to expedite the process, we could send some bubbles through the water containing the chlorine, and that will also reduce the chlorine level. Now, two forms of vitamin C, which is now ascorbic acid and sodium ascorbate, will neutralize chlorine. And neither of these compounds are hazardous. In 1908, the US, in Jersey City again, used chlorine for potable drinking water. And in 1914, the US Department of Treasury established standard for potable water in the United States. Now, some negative effect of chlorine. We have that some chlorinated compound masquerade as hormones when ingested. And so yeah, some chlorinated compound masquerade as hormones when ingested. And the chlorine can irritate the eyes, the skin, the ear, and the teeth. Chlorine can irritate the eyes, the skin, the ear, and the teeth. And in addition, some chlorinated compounds masquerade as hormones when ingested. So they masquerade as hormones. You will think that, well, then it's hormones and then are these chlorinated compounds. So it's a matter of like deception. Now, pools with too much high chlorine content with high chlorine can build up chloroamines, which can also affect the respiratory system. And chlorine enters the body via breathing, swallowing, or by skin contact. And it readily reacts with moisture and water to form acids. And these acids, whether within the body or on the surface, can help to destroy cells. Now, the immediate effect of chlorine, negative effect, would be chlorine exposure can cause airway irritation, can also cause wheezing, difficulty in breathing, sore throat, cough, eye and skin irritation. So that's it for just a brief focus on chlorine, chlorination and its negative effect, why it's banned, why it's not readily available as for tangible substance. Its positive effect in making water safe, and the negative effect on the body in terms of breathing and irritation of the eyes and all of that. So on the next bout, we'll look at the 18th element, which would be argon. But for now, let's just close off with the chlorine here. Okay, this is a look at chlorine. in the 17 group there. We have fluorine, 18.998, and then next would be chlorine, 17. See the 17 there, and 35.45. And next will be bromine, but we're concentrating on chlorine here, 17 and 35.45 in group 17, the halogen family.